Hello everyone, I hope you all are doing great. So I welcome you all today to our new session, and in this lecture today I'll be teaching you all with the NORMA FRONTALIS, that is the frontal view of your skull. This is very important for your OSPE point of view, practical examinations and all related to osteology section. I'll be trying my best of all to include all the most important points for your examination. I hope you'll be listening with great attention. So let us get started. Firstly, as you all should know that your frontal view or the frontal part of the skull is going to contain the 5 basic bony landmarks, in which there is the frontal bone, this is the frontal bone, and then the presence of zygomatic bone, the maxillary bone, here is the nasal bone, and this is the mandible, right? Very easy. So we'll be discussing about each and every part of them, not in that much detail, just to make it very clear that this orbit and the nasal part will be discussed in very detail in a separate lecture, in a separate video, because it's a very comprehensive part right here now. So the frontal part, if you talk about the frontal part, you all know that there is a presence of an orbit, and above the orbit is the presence of a supraciliary arch, the points that are going to mark your eyebrows, right? So this is the presence of supraciliary arch, and just above the both orbital margins is the presence of supraorbital foramen, right? The word supraorbital notch or the foramen is utilized to explain this point, because supra means above and orbital means of course the orbit, right? So an opening or a small hole that is basically present, if you can see here in both these areas, is a supraorbital foramen or the notch, and is a very important opening point that is going to provide the pathway for the supraorbital nerve and vessels, right? In the similar way, just perpendicular to this point is the presence of infraorbital notch or the foramen that we'll be discussing in a bit detail in a while. So there is the presence of the frontal bone, right? If I talk about the margins of the orbit, so the orbit is going to contain superiorly the frontal bone, laterally is the presence of zygomatic bone, right? And here inferiorly is the zygomatic and maxilla, zygomatic bone and maxilla, and medially is the presence of maxillary bone and the frontal bone. As I have already said that we'll be discussing about the entire orbital cavity in a bit detail in a while, right, in the next lecture. So here is the presence of the orbit, and since we discussed about the frontal bone, there is a presence of the supraorbital foramen or the notch. In the case of the next bone, that is the nasal bone are going to meet at a common point that is called as nasion, right? And this would laterally going to be in contact with the maxilla. The nose is actually a cavity, here is a nasal cavity that is going to contain the vomer. This entire plate is going to be called as a nasal septum, and the nasal septum is made up of the two bones, the perpendicular part or ethmoid and the vomer. I'll just show you all. This is actually the anterior view if you want to see it laterally, so you can see this is the portion. This part is the perpendicular plate of the ethmoid, the perpendicular plate of the ethmoid, this part, and here is the vomer. Superiorly is made up of the perpendicular plate of ethmoid, and inferiorly it is made up of the vomer bone. And to make it very clear, where are the presence of superior, middle and inferior nasal concha. If you can see, here is the middle nasal concha and this is the inferior nasal concha. The superior and the middle nasal concha are a part of ethmoid bone. Here, they're the part of ethmoid bone, right? But the inferior nasal concha is a completely separate bone. Never ever confuse it with the vomer, right? Keep it in your mind that the inferior nasal concha is a separate bone, not a part of ethmoid, neither a part of vomer, right? So yeah, they were discussing about the nose. Here is the presence of the anterior nasal spine. That is basically the point where it's going to the point of the maxilla is going to meet here, right? Then there's the presence of zygomatic bone, you know, the small cheeky bones. They're going to make your cheeky prominence. So this is the zygomatic bone, is a more important extension of the temporal process that are going to match on your lateral side, right? This is going to contain two foramens again, a zygomaticofacial foramen that is being shown here and a zygomaticotemporal foramen here, that is going to give the pathway for the zygomaticofacial and zygomaticotemporal nerves, right? After the zygomatic bone is a maxilla. Embryologically, the maxilla are the two bones, right and left. But later on, and they are actually held together by the intramaxillary suture. Later on, with the development, they will become they'll join together and make a single bone. And as I've already told you all, here is the presence of the infraorbital foramen, or the notch in the zygomatic bone, that is going to provide the pathway for the infraorbital nerve and vessels, right? An important thing here, that the maxilla is going to contain the alveolar processes. These are the alveolar processes, the part where the teeth would be embedded. These grooves, you could see, they are the alveolar processes, right? Then there's the presence of mandible, the mandible that is going to make your jaw. And this mandible is going to contain, if I would like to explain you in a separate diagram, there is a bit detail of it. So the mandible is going to contain a horizontal body. This is the body of the mandible. Here is the presence of the angle of the mandible, and then the presence of two vertical rami, right? This is such a beautiful bone. You can see here is a presence of a foramen. This is called the mantle foramen. I'll show you in the frontal view as well. But this mandibular foramen here, this part is called the mandibular foramen, is going to lead all the way from the medial part of the mandible. This interior part is called the medial part, and the external part is basically hair present. So the medial part here is going to contain a mandibular foramen. This is the mandibular foramen. The mandibular foramen is going to lead all the way through the bone into the exterior, the mantle foramen, and here is the presence of the mantle foramen, right? This portion. And as we've already seen, there is a presence of the mantle protuberance as well, and the mandible having the rami and the body and the angle of the mandible here, and it's the only movable bone that is present in your frontal view, right? So this was all about the norma frontalis. We'll be discussing about the orbit. It's a very complicated structure. Here, this lecture will be discussing about the orbit. We'll be discussing about the nose and the other part of the mandible and a separate lecture, because they are completely different bony prominences. We were discussing about the norma lateralis and the inferior view as well. So I hope you all like this lecture, and I request you that if you are benefited at any portion, any point of this lecture, consider subscribing and supporting me, because I am having a very tough schedule and it's very difficult for me to upload regularly. So whatever you demand, I'll try my best to clear your concepts by this means. Thank you so much for watching. Like, share and subscribe.